Founded in 1998, the Thumbay Group is an international business conglomerate with its headquarters in the UAE. Their latest project, the GMC Hospital chain, offers state-of-the-art technology and advanced surgical services. And here to discuss this further is Director of Operations, Akbar Thumbay. Akbar, welcome.
Thank you, Nick.
What services does the GMC Hospital chain have to offer?
The GMC Hospital offers all kinds of services, right from your executive health checkups, where you come in, you're received personally by your patient relations coordinator and takes you all the way across the hospital into your different checkup areas. Right from the executive health checkup up to, consultation with various specialists, consultants in all specialities, and of course, major surgeries such as cardiac surgeries or neurosurgeries, etc. So GMC hospitals offer the spectrum of services. We have different facilities in Ajman, Fujairah and Sharjah, and some of these facilities are concentrated. For example, the Sharjah facility is a specialized super specialty dental center. So you get all your dental work done in the Sharjah center.
And in what ways are you different from your competition?
Like I said, GMC Hospital is the first private teaching hospital in the UAE. What it means is that our students of the Gulf Medical University are rotated across in the hospitals. So what I say would be different is that the clinicians or the doctors who are practicing in the hospital are not just clinicians or doctors who are practicing in the hospital, but they're professors. So they've been teaching students for the last 10 years, so their knowledge levels are much higher than normal clinicians. That was the first advantage. The second advantage, which is also a major advantage I would say, is that being a teaching hospital, our prices are considerably subsidized. The reason being is that we need a lot of patients so that students can examine or observe various cases that are happening across the UAE. So these are the two major advantages GMC hospitals offer compared to the other private hospitals in the UAE.
Now, you offer advanced medical and surgical treatments. Tell us about these.
We offer advanced medical and surgical treatments across the spectrum of specialities in the hospitals. So, for example, some of the hospitals are concentrated on various specialities. The Sharjah facility, for example, is concentrating on dental care. The Ajman facility would be obstetrics and gynecology. We do advanced surgeries in gynecology. We deliver over 20 babies almost a day, which is quite a considerable number in the UAE. We have various other facilities. Fujairah, for example, is specialized in internal medicine, and we have neurosurgery, cardiac surgeries across the hospitals.
And tell us how these facilities support the treatments that you mentioned there.
Again, we have state-of-the-art equipment, state-of-the-art facilities across the hospitals. The Ajman facilities have 4 major operation theatres, some of them hybrid theatres with laminar flow and all the advancements that basically money can buy in terms of healthcare. Our radiology is completely full-fledged with, again, the latest technology being used for diagnostics. The lab or the diagnostic center is, again, highly super specialized, where most of the other hospitals use our lab facilities to report or to reconfirm test results, etc. So in terms of facilities, we are a very advanced facility.
What can you tell us about the services you offer to your international patients?
We receive patients from across the world, starting from Africa down to the Middle East itself and Europe, Southern Europe, including the Western Hemisphere as well. These patients basically come to us for various reasons. The first reason what happened was that Dubai, being a central city connected by Emirates or various flights, made it very convenient for patients to fly into Dubai. And patients, especially African patients who are traveling to India, had to route their flights through Dubai to go into India. So what happened was, that's where we saw an opportunity and we said, hey, why go to India? Let's give the treatment right here in Dubai. So that's where our patients started coming in from. We get patients again from Southern Europe, especially for dental work, one being a super specialized center and the prices being very affordable compared to Europe. These were the two main reasons that people started coming in. And lastly, I believe that healthcare is about personalized service, and that's where we stood out. And we had a person who used to be either from their own country or speaks their language, so that they're comfortable and they're able to recoup during their surgical procedure in their home environment.
Finally, what are Thumbay Group's plans for the future of healthcare?
Thumbay Group, headed by our president, Mr. Thumbay Moideen. Mr. Thumbay Moideen has an incredible vision for healthcare for the future. In fact, he envisions us to have 15 hospitals in the next 7 years, taking our bed strength to above 1,000 beds, making us the largest healthcare provider in the Middle East. We as such in the hospitals have an incredible plan as well to get into various specialties, including lots of tertiary care surgeries that are not being done right now in the Middle East, and where people travel across from Middle East to get these surgeries done. So we want to be able to do those surgeries down here in Dubai itself. Secondly, our healthcare is not only our hospitals, but also the pharmacies and the diagnostic centers and the labs. So we're growing the labs to make it the most advanced lab in the country, and we're expecting samples to be sent from right down from Africa to be tested in our labs. The pharmacies as such is growing, and we want to position ourselves close to everybody's home, so you have easy access into every one of GMC pharmacies. As such, I think we have a great vision for the future, and I look forward to working hard to achieve that vision.
Akbar, thank you.
Thank you, Nick.